All right, here we go. We're honored today to have Dr. Khan, who is a medical doctor in the front lines of the whole coronavirus battle right now in the hospitals of Las Vegas, speaking to us today. And ironically enough, Dr. Khan has an alter ego as a rapper by the name of Lazarus, who's actually been on tour with Wu-Tang and has songs with people like Ghostface and Royce the 5'9", which we're going to cover at the end of the interview. But I think right now it's very important with the whole world going through the whole coronavirus situation to really get some information from someone that actually is working with the disease day to day. And I want to get into some of these questions, but first I want to talk about your background a little bit. So, at what point did you decide to become a doctor?
Man, I was probably maybe 8 years old around the time when my grandmother died of diabetes, and there was just a pondering question that came upon me at that time where I just, I questioned myself, like, why did she leave the earth? Like, why is she no longer on this planet? And then when I started to learn about diseases and pathologies, and she had diabetes, and I started, questioning all those things, it kind of made me, want to pursue the career of medicine. And I started becoming inquisitive. I started following doctors around. I became infatuated with doctors. And, over the course of the years and stuff, I just stayed in tune with it. I started excelling really well in school. And it's like, what are you going to do? What are you going to be when you grow up? And it was a doctor. You know what I'm saying? So,
Dope.
yeah.
Dope. So you went to high school.
Yep.
And then you went to college where?
I went to college at Wayne State University in Detroit.
Okay. And at that point you were pre-med?
Yeah, I was pre-med biology major at that time. And so, I was basically just all in the books, man, between doing the hip hop, which I was doing, I was also, pursuing medicine at the same time. But I didn't know what I was going to be at that time. But I kept doing well. I was doing organic chemistry, biology, and then I got accepted to medical school, Michigan State University.
Okay, so that's where you did your graduate program.
Yeah.
Okay, so for those that don't know, you do 4 years undergrad.
Right.
Then you go to graduate school, medical school for how many years?
4 years.
4 more years.
Right.
So that's 8 years.
That's 8 years right there.
Then once you graduate, then you start your residency.
Right. So I did residency for 3 years.
Okay. So this is 11 years.
It's a lot of years, man.
Yeah. For those that want to become a doctor, it's 11 years on top of the 12 years that you've already done.
And that's like back-breaking work too. It's not like 11 years that pass by. Like you got to literally put in like 16 to 18 hours a day on days repeatedly, back to back to back to back. You basically give up your whole, teenage years.
Yeah.
You know what I'm saying? Your 20s are gone.
Yeah.
You know what I'm saying? You have no time to, phone call your family. Like that's how busy it gets over there. So it's it's ridiculous.
Yeah, I mean, this is why when people say doctors don't know anything and you shouldn't listen to doctors, you've just devoted 23 years. Hold on. 4 plus 3, 7, 10 plus 12, 22 years of your life.
Right.
Of learning to call yourself Dr. Khan.
Absolutely.
Okay. Before coronavirus, there was other, what I would call similar type of viruses that were circulating around the world. There's SARS,
Yeah.
H1N1,
Right.
the swine flu.
Mm-hmm.
Any that I'm forgetting?
Those were the main ones, I would say, like, besides just the regular influenza, different strains that came every year. But yeah, the swine flu, that was 2009. We had the SARS before it. Those are the two big ones that people talked about. It was Ebola, but you know what I'm saying?
Ebola, yeah, that's another one. So did you actually deal with patients with any of these conditions?
No, I didn't deal with any of those outbreak situations. And I think SARS was just that wasn't a pandemic situation like this is. H1N1, I remember 2009 at that time, there was a lot of talk about it, but it was at that time, it was downplayed, but I feel like it was rightfully downplayed. It wasn't, even the mortality rate for that was very small.
Okay. So then the coronavirus pops up.
Right.
At what point did you first hear about it?
Man, I heard about it maybe like in January. I started hearing a little bit of buzz about it. And it's like you hear a little bit about it and then you don't think too much about it. You just think, oh, it's just going to fade away. It's not really too much more to it. And then as time went by, you started hearing more about it and more about it. And then you're hearing this is going on in China. And then got to the point where all the, on social media, all the platforms is talking about coronavirus. I, just like everybody else, wasn't really taking it serious. I was just like, okay, well, this is going to pass by real fast. And it's just another flu. You know what I'm
Okay.
saying?
So they say this, that it started in Wuhan, China.
Right.
And it started to really get very serious in China, where you had more and more cases. Wuhan was essentially ground zero.
Mm-hmm.
And it started to spread into other places in China. And then it started to hit Europe, and it started to hit the United States. At what point did you say, okay, this might be a real serious thing right now?
When you started hearing about the cases in Italy and China, and then it starts growing and then you start, they start looking at the charts of how the spread is happening, and then you see it starting to just slowly spread all around the world, and it was a question of whether this is going to be if it's going to be an epidemic or if it's actually going to become officially a pandemic.
Mm-hmm.
And it was like at that time when it officially became a pandemic, when we were like, okay, we got to take this a little bit more serious, because before we know it, we're going to start seeing patients in the hospital with these symptoms that people are having for the coronavirus. But even at that time, nobody was taking it serious to what it actually is.
Okay, and what exactly is coronavirus?
So coronavirus, it's an RNA virus, which makes up the molecular components of it. And what the virus is basically, it's the coronavirus is the common cold is also a coronavirus. This just happens to be a different, basically in the same family as what the other coronavirus is. But this virus is doing things that those previous viruses in the coronavirus family never did before. And that's what's making it so crazy.
What do you mean that it's doing things that the other ones?
So the symptoms, you're not just having the same type of common cold symptoms. Like, you're having flu-like symptoms, and after those flu-like symptoms go away, then the virus goes down into your lower respiratory tract, and you start getting pneumonia. And that never happened. You don't get that happening with the flu. Now with the flu, if you have a bacterial pneumonia on top of, that is superimposed on your infection, that's different. But this is a viral pneumonia. It's a different story.
Okay. And does this coronavirus spread faster than a typical flu or a cold?
It seems to be spreading faster. Yeah.
Okay.
Yep.
How do you get infected with coronavirus?
You get infected with coronavirus through respiratory droplets. So if somebody is coughing or sneezing or even breathing deeply around you, that respiratory droplet could come out, and all you need for it is to get in your mouth or your nose or your eyes.
Okay. And they say that actually lingers in the air?
They're saying that it lingers in the air, but I don't think so. I think it just like other infections that are spread through respiratory droplets, it might be in the air just momentarily, and then it's not going to stay in the air afterwards.
Because you hear 6 feet. You should keep 6, because that's as far as it could fly.
Yeah,
basically.
Exactly. So it's like a trajectory. Think like if I'm talking to you right now, if I coughed or I sneezed, that droplet's going to go about that distance, and then it's going to drop.
Okay. Why is it spreading so fast compared to other, typical infections?
The reason it's spreading so fast, the reason why why it's so viral is because you end up having no symptoms for a long time. Unlike the flu, and that's what's throwing a lot of people off guard, is you can be asymptomatic for up to 2 weeks. So you could have no symptoms at all, and you're spreading it around to people around you. So the number of people that you're infecting it, spreading it to, it's already, 3 or 4 times more than you would with the influenza or with the flu, because you get symptoms right away in 1 or 2 days with that.
Right. 'Cause I did some reading about the comparison of coronavirus to SARS.
Right.
And, SARS didn't die a natural death.
Mm-hmm.
But the thing with SARS is that you show very serious symptoms right away.
Right.
And once they had these pockets of places that had SARS, people started getting really sick, and they massively quarantined those areas. They essentially
and
killed
they was able
off
to control it.
Yeah, they killed off that virus by man-made, heavy-handed tactics.
Right.
This is a different situation. And they talked about how 25% of the people who have it don't show any symptoms, and they're out there spreading it to other people.
Right, exactly. And that's why it's so viral, because, forgive me, but I might be spreading it to Vlad right now if I don't know I have it.
Yeah.
You know what I'm saying?
Yeah, no, that's true. And being, since we're a news media source, we're on the front lines, taking those risks.
But, the scary thing for me is like, every day I got to go to the hospital, and, the medical staff around me, they could all have it and I don't know they have it. So it just kind of puts me in this situation where, I'm having to risk my life every single day because there's people dying. There's doctors that are passing away from this. And it's like, as you start coming to learn all this information, I think there's a doctor that just passed away in New Jersey. Relatively young doctor too. And at first I was just hearing that it's older people that's actually, getting affected as far as dying from the virus. But, I'm seeing patients in the hospital that are a lot younger and they're getting very critical and going to the ICU.
Well, right. The original doctor that kind of broke the whole story about this in Wuhan ended up dying from coronavirus. And he was a relatively young guy.
Yeah.
In his 40s, maybe?
Yep.
Okay. So take me through the process. At the point that somebody gets infected, what happens day by day, week by week?
Right. So you're gonna contract. Let's say you just contracted the virus. You might be asymptomatic for anywhere from 5 to 12, up to 2 weeks.
Okay. And by asymptomatic, that means
nothing.
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 No cough, no fever, no
You're just a
headache,
carrier.
no strains.
But at the same time, you're still passing those respiratory droplets around.
Yeah.
So you have no symptoms. And then when people start developing the symptoms, they might get the sniffles a little bit. They might, the main things that people are seeing is they have a fever. So you get a fever that happens, and then at the same time, you might get a dry cough as well. So those are the main things that people see initially.
Okay. And you could test positive and not have symptoms at all, ever?
There have been cases like that where people, or maybe they didn't report it. All the cases that I've seen that have been positive with COVID-19 have all had symptoms.
Okay. And tell me what the testing process is like, because there's been all types of new tests that have been introduced. I've heard of a 15-minute test, a 5-minute test.
Yeah, I've heard about those. I can speak on the ones that we use at the hospital that I'm at. And basically, we have to send it to an external laboratory, and they have to do something called polymerase chain reaction, which it's a process where they extract the RNA from the virus, and they have to. It actually takes it's a 6-hour process from beginning to end. And you got to imagine all the people that, are being ruled out for coronavirus and that being backed up. It's been taking about 48 hours to 72 hours. I've actually had situations where I had to wait a week before I even had a result back on a patient, which causes pandemonium because I got all these people coming to the hospital to rule out COVID-19 and they have to sit in the hospital for that long until the test comes back.
Yeah. I mean, I know people that have gotten sick, have had coughs, have had temperatures, chest pains, whatever. They go to an urgent care or a hospital and they just said, we're not going to test you.
Right. And that's where the trend has started going to. So in the beginning, when this first started coming into the hospital, everybody was in such panic mode because of what they'd seen in Italy, China, and things like that. So as we started getting it, we started admitting everybody at first. So if somebody comes in with a cough or a fever, they're getting admitted, and we're having to see them, which is panic for all us medical staff because we're looking at these patients coming into the hospital. We don't have enough beds. We don't have enough masks. We don't have enough equipment to see all these people and put them in isolation rooms. But then as it progressed, we started narrowing the people that we're actually admitting to the hospital.
Okay. So there's different types of tests.
Right.
Is one of them a blood test or no?
The only test that I've seen happen is the nasopharyngeal swab.
Okay. And they put it way up in your brain pretty much.
Yeah, it's a little uncomfortable.
Okay. But I had heard that there's a new test that you don't have to go all the way up there, where doesn't have to be done by a medical professional, where a regular person could just use the Q-tip and then basically send it in. Do you know anything about this?
No, I haven't seen that utilized.
I read about it, but it might be still experimental and so forth. Are there new tests that are coming? This whole 5-minute test and
They're trying to, as soon as they implement or try to get something, we'll definitely know, the hospital staff where I'm working at in the hospital. But as far as, everything that I've been seeing, it's just been that.
Well, the thing with the 5-minute test also, it's a single test.
Right.
Whereas the other tests, they're like mass tests that are being done, 60, 100 at a time.
Right.
So the single test can only really be done at the hospital itself.
Yeah.
And it's very limited. For everybody that is going through this right now, who don't have it or don't know that they have it, how do you protect yourself?
The best way to protect yourself, man, is practice social distancing. I know that's just out there to the tremendous degree, but you gotta keep yourself distant from other people because, like I said before, you don't know if you're infecting them, even if you have no symptoms. You don't know you're sick or not. That's the whole reason why we need to do that. We need to obviously maintain our hygiene, wash our hands. Other things that people can do to protect themselves, almost like prophylaxis. Take vitamin C. Take NAC, which brings up your glutathione levels, antioxidants, in your body. You know what I'm saying? Ginger is good. You try that. Black seed, certain things that people can do just outside of just any prescription.
Okay, because you always hear about, vitamins,
Yeah.
vitamin C. You've heard
I
black
always
seed
promote. I
oil.
always promote that stuff too.
Okay,
I'm
but
not. I'm not one of those doctors that's just only what's on the prescription pad.
okay, but is there actual medical evidence that these things are blocking it or slowing it down?
Not in particular. I think for any medication or any supplement that's being used for coronavirus, there's not enough cases or studies at this particular moment in time for us to say that it's a proven treatment.
Okay, now this is sort of the question that I think is on a lot of people's minds right now. First of all, the gloves.
Yeah.
Do you recommend that people wear gloves or not?
I recommend it. I don't always use the gloves, but I mean, it's just protecting yourself from, anything that's on surfaces because they put a lot of emphasis on surfaces having the virus and you could pick it up off surfaces. But as long as you're washing your hands regularly, I don't think you necessarily need to wear them.
Okay, because you hear stories of like, you shouldn't wear gloves because the virus can get on the glove and it sticks more to the glove than flesh. And then you basically have more of a chance of carrying it around and also taking it on and putting it off. People
Right.
don't really know how to do that
I mean,
properly.
I think either or. I haven't heard anything about the glove versus the hand, but the bottom line is, you want to constantly maintain your hygiene. That's why I wash my hands repeatedly, and
Yeah.
I feel like that's probably the best way to do it. The other thing is even with the mask, because a lot of people ask questions about should I be wearing a mask when I go outside. In the hospital, it's funny when I go in the hospital, they advise the medical staff not to wear the mask on floors that are non-COVID.
Why is that?
The reason for that is because, if you're going into a room that has a COVID positive or a COVID rule out, you put the N95 mask on, and then you go to a regular floor with that same mask on because we don't have enough masks in the hospital. So if you're reusing the same mask, and I think that's one of the reasons they say that one physician passed away in New Jersey is because he was reusing the same mask over and over again. So he's like getting he's getting that contaminant, whatever's on his mask out there,
Okay. And the N95 masks, those are the ones that kind of seal around your
Right.
face?
They have a tight, that's what differentiates them from the regular surgical mask.
Okay. But there's a couple of, there's N95 and then there's something else.
That N95 is the main mask that's being recommended right now.
Now, what about like the regular mask
The surgical
the
mask?
surgical mask?
I mean, the
Does that
surgical
help at
mask,
all?
it does help. Obviously, it doesn't have the tight seal that the N95 mask has, but it still will, help prevent some of the virus from getting on you.
Okay, so it's better than nothing.
Yeah, definitely.
Okay. So you suggest when people go outside, when they go to the grocery store or whatever, they should wear gloves and they should wear a mask? Or
The gloves, that's this. If they want to take that extra precaution, they can. And that new thing that you're telling me about the gloves, and I mean, I recommend mostly the mask. Just the surgical mask is fine for you to wear. But more importantly, it's if you feel like you might have it or that you've been around it and that you might be contaminating other people is when you should really wear the mask in public.
okay.
The most important thing
more
is
to
you
protect
keep your
other
distance.
people from
You keep
yourself.
the most important thing is you keep that distance from people.
Now, what medicines are being used to treat patients?
Well, when we first started trying medications based on, trials that were being done in other parts of the world, the medication that seems to be effective right now on coronavirus is a medication called hydroxychloroquine. It's also Plaquenil. That's the other name for it. And that's been shown to decrease the amount of time that the patient goes into that viral pneumonia stage because a couple things. It increases the pH level of cells that are infected by the virus, which prevents it from entering those cells. And then at the same time, it also has this autoimmune, your immune system has hyperreactive state, basically. What happens when the virus gets into your lungs, you start developing a lot of inflammation and your immune response is very strong on top of the virus infection, and trying to bring that down a little bit has actually alleviated a lot of the symptoms that you get at that stage.
Okay, now there's another one also. Azithromycin?
Azithromycin.
Azithromycin.
Azithromycin has been coupled with the hydroxychloroquine, and that's an antibiotic. So a question a lot of people ask then is, why are you giving an antibiotic for a virus? And the reason they do that is because when your immune system is brought down by the hydroxychloroquine, it'll help prevent some secondary bacterial infections that could form at that time.
Okay, I've heard that massive shots of vitamin C are being administered. Have you heard of that?
It's being tried. Yeah, we've been trying that, vitamin C. I mean,
Okay.
whether that is actually making the difference or not, it's not really been tested, but we've been trying it because vitamin C has helped viruses in the past.
Okay.
Viruses.
I've heard about zinc as well.
Zinc as well, right? Especially zinc lozenges. They say it's good for, patients that are having upper respiratory symptoms and sore throat, things like that.
Okay. But that's more of a treatment rather than a preventive.
Oh, both.
Both.
Yeah. You can use zinc and vitamin C. I've been taking zinc and vitamin C every day.
Okay.
Yeah.
I'm about to go take some myself.
Yeah, most definitely.
So tell me about the vaccines, from what you understand. Right now, there is no vaccine.
There's no vaccine.
A couple of weeks ago, the first human trials started for a vaccine.
Yeah.
But from what I understand, the only thing more dangerous than a bad virus is a bad vaccine.
Okay. Well, understanding what a vaccine is, basically it's a antigen, it's a component of the virus, right? And that will elicit antibodies to develop without the virus actually infecting you. So that's what the vaccine is. It's trying to emulate you being infected without you having the symptoms of the infection, so you can develop the defense to it.
Okay. So a flu shot, is that a vaccine for
Yep.
other types of
so
infections?
they'll make a new one every time there's a new strain of influenza.
Right.
So it's basically taking a isolated element of that virus that's going to allow those same antibodies to develop that would have developed if you had the flu, but you don't have to go through the symptoms of the flu.
Okay. Like I'm on a flu shot right now.
Okay.
I talked to my doctor and he recommended that I take a flu shot. Last year I did, and the year before I did, and I was fine. So I have no problems doing it. Are you on a flu shot yourself?
Yeah.
Okay. A lot of people are scared of flu shots.
Yeah, people obviously have, they raise issues with vaccines. Obviously, I promote it. I think that, people should be vaccinated. Now, there are situations where somebody might get a mild form of the infection, with the vaccine, but, have a full-blown infection is pretty rare.
Okay. Now, when do you see an actual vaccine coming?
Man, at this point in time, probably not for at least 6 months. Probably going to take some time.
Yeah, I mean, they're saying a year and a half.
Well,
Okay.
it's going to be some time.
It's going to be some time.
It's going to be some time before that comes out.
Well, here's the other thing that I've always wondered about. Will there be a test to see if you're now immune to the coronavirus?
That's all up in the air right now. It's hard to tell because they're saying that a lot of people that are getting the infection are able to get reinfected. And that's another scary element of it. Now, cases that I've heard about, they don't get as severe of symptoms as the people that had it first, like when they first had it. But there has been cases of people getting reinfected after they already went through getting antibodies for it.
Right, because there's the Idris Elba situation where he was sick from coronavirus. His wife, came down to live, to stay with him. She got sick as well. And he announced that his doctor told him that he can't get the coronavirus again. Is that just not true?
I mean, like I said, if there's cases out there, I can't say no.
Got it. Now, in terms of people dying, what's the percentage? Because you hear numbers from 0.5% to 6% to 8% to 2%.
Right. I mean, the numbers are jumping around. I think currently, what is it like? At the last I checked, it was like 850,000 total people who have it, and then it's like 45,000 deaths or something. It might be higher than that now, but it's somewhere around the lines of 4% people that are getting it.
But is it really 4%? Because it's only 4% of the people that test positive.
Right.
Not 4% of every single human being.
Right. So you can't have the exact number figure right now for this.
I mean, if they're saying 4% of everyone who tests positive, can you say that for everyone who does a test, there's 10 people who don't do a test who are positive? So that number is really 0.4%.
You can say that because, obviously we're only looking at that bracket of people that
Yeah.
actually tested positive.
Exactly. And like I said before, I know people who were sick and are sick
Right.
that simply cannot
Right.
get a test.
Right. And think about all the underreported cases all around the world right now.
Exactly. So let's talk about your whole experience with it on the front lines.
For sure.
What date was your first patient that tested positive for coronavirus?
I think this whole thing just kind of went crazy like around March 13th. I
Okay.
think that's when really shit hit the fan. I went to the hospital and all of a sudden my life was actually being affected by all this stuff that, we've been hearing about in the media and things like that. And now it's like the floodgates just opened up and you're hearing talk in the hospital from the nursing staff and your colleagues and stuff. Oh, we're getting all the rule outs for the COVID coming in. And we all, everybody got the anxiety about it. Oh, like the COVID, people are dying from this and this is causing all this in China and all this panic. And so it's like you got to take a deep breath and you got to be like, all right, well, I got to see these patients now. Now they're going to be part of my patients.
Yeah.
So you see them and then you're seeing patients that are being ruled out. First, you see them getting admitted from the emergency room. So at that time, around March 13th, we started admitting patients in the hospital just for having a fever, just for having a simple cough. So now we're bringing them into the isolation rooms and we're just monitoring them. We order their test, but then at this time, I'm thinking, okay, the test, just like, you get the rapid flu test, you know right away. But no, it's like you actually have to wait. And it's like 48 to 72 hours. You actually have to wait until the test comes back before you can even discharge this patient. And so I'm starting to notice the symptoms they're having. I'm thinking to myself at this time, just like everybody else, oh, this is just the regular flu. It's just coming. Even if I get sick, it's just like me getting sick with the flu. So what, right? What's the big deal? But then, man, I start monitoring these patients, and I'm like, man, these patients are sick. Like this ain't no flu, man. Like I saw a 32-year-old female, no medical history, none whatsoever. Just healthy as a horse, And she comes in and she's having this shortness of breath that she feels like she just walked up like 20 flights of stairs. And she's like, I can't breathe. Like she was just looking at her, just was scary. And I'm thinking to myself, like, this thing is spreading the way it is. I could get it. The staff over here could have it. So I'm just kind of like put in this situation where I'm internally going through a struggle of what am I going to do going home now? What if I got this,
Okay. So March 13th was the first positive case in your hospital in Las Vegas. Which hospital is it?
It's Spring Valley Hospital.
Okay, so Spring Valley, March 13th. That's patient 0 for you guys. How quickly do these positive results start to come back day after day?
So obviously, you have all these patients that are admitted and you sent out for testing. So now you start getting 48 hours to 72 hours later, you start getting results back. So those patients that come back testing negative, or if they have influenza, we're sending them out. We get them out of there. But the COVID positive patients, we're still monitoring them closely. Now, later on, we started sending patients home even with COVID positive so they could just self-quarantine at home unless their symptoms got really bad.
Okay. What percentage of the patients were you sending home versus keeping in the hospital?
Well, I had probably like 12 patients that I actually had tested positive that I was monitoring. And out of those patients, half of them got sent home and half of them got sent over to the intensive care unit.
Okay. How many of those started to get better? The 12 that stayed?
Out of the 12 that stayed, so the 6 that we were able to send home.
Okay, I see what you're saying. So,
yeah,
okay.
the ones that stayed, they actually had to upgrade to the intensive care unit.
Okay, so you had 12, 6 went home, 6 stayed. Out of the 6 that stayed, what happened to those?
So out of the 6 people that stayed, a couple of them died.
Wow.
A couple of them died.
You and I spoke, when we originally spoke last
Right.
week, you told me that none of your patients had died.
Yeah, at that time, none of them died.
And a couple of days ago, you texted me and said a couple of my patients had died.
Right.
You're a doctor. You have to deal with this. Have you had other patients die for other reasons?
I mean, I see death, all the time in my line of work. It just hit me a little bit different here because these are people that are dying that otherwise you wouldn't have expected to have died unless they got into a car crash or an accident. And they died of something we could all be getting. So that was the scariest part for me because I'm looking at a patient. One of them that died was about 62 years old. And the only past medical history they had was hypertension.
Huh.
So you got to think This could be your uncle. This could be, somebody, he's a close friend of yours. You don't even call them sick or medically unstable in any shape or form. And this person died because they went into respiratory failure from this virus.
Okay. Now, there's the whole thing with the respirators.
Mm-hmm.
My father passed away a few months ago.
Sorry to hear about
He had Parkinson's, and it started to break down his ability to breathe. And we put him on a respirator. We took him off the respirator. He started to get a little bit better. And then we put him on the respirator again. And then my doctor and I, we came to the conclusion that we basically have to do a do not resuscitate, because we figured that if we take him off the respirator again, he's not going to make it. So
Right.
I had to make the tough decision.
That's painful.
A respirator is not like a Band-Aid.
No.
It's a very serious device that
Right.
they stick a plastic tube down your throat, potentially tearing your throat in the process. By the time you get to a respirator, you are, essentially on the edge of death.
Right.
Is that correct?
Exactly. And it's like, these patients, a lot of them don't have any lung history or COPD or anything. So imagine I'm seeing these patients, they're completely normal. I'm talking to them. They seem fine. 2 days later, they're on a ventilator and they're close to dying. And the other scary thing is that they can't even see their family members. So I've been the one kind of mediating all conversations with the family because they can't go in those rooms.
Yeah.
And so I'm having to I'm constantly getting hit up by family members asking me like, how is my dad doing? Like, is he going to make it? Is he going to live? And it's like, I have to answer the family. I got to tell them what's going on. And they're like, they have the coronavirus. Everyone's scared to death, man.
Yeah, I mean, you hear horror stories. I remember reading about this woman, this older woman who died from coronavirus. A lot of her family members went to the funeral. 17 family members tested positive. One died and a couple were in intensive care.
Right.
It's like nothing you've ever seen before. Does obesity have anything to do with this, or they're not sure yet?
I mean, they're not sure, but they have shown that elevated blood pressure, a lot of people have uncontrolled hypertension, and those people actually have been shown to have 1.7 times a greater risk of mortality.
Wow.
Yeah.
Have any of your colleagues, doctors, nurses, admin staff at the hospital, have any of them tested positive?
They have not, but right now there's a lot of my colleagues that are taking off shifts, and it's like they don't want to come to work. But yeah, I've been getting calls to cover. I've been working the last 3 weeks nonstop. You know what I'm saying? But yeah, I haven't actually seen anyone that actually tested positive yet.
Okay.
But you hear these stories, man, like people in Italy, there's like 2,600 medical staff that are, infected and things like that. So it's scary, man.
I want to get into some of the conspiracy theories about coronavirus, because, a lot of people research their medical information off memes.
Sure.
And I think it's very important when we have an actual medical professional in the house to really address those, because we have a lot of guests, people like Lord Jamar and John Sally, who have their own ideas about medical practices that I don't agree with, but I'm not in a position to argue with them because I don't have any medical training myself. So initially, Waka Flocka said that black people can't get it.
Yeah, ask that to all my homies in Detroit, man. They all got family members that got it, and they got family members that are dying from it, and they're black.
Yeah, I think right after he said it, a bunch of the NBA players started getting it.
Yeah, I got patients in my hospital that have it, that are African American.
Cardi B felt that celebs were being paid to say that they have it.
The patients in my hospital ain't getting paid to say they have it.
Yeah. Carrie Hilson, in a set of deleted tweets, and this is something that people have been bombarding me with. She felt that 5G cellular service somehow triggered the coronavirus, or has something to do.
Vlad, what if I told you, hey, Vlad, you just blinked, so that's why it's raining outside? That's how I feel about that.
So it's ridiculous.
Yeah, it's offensive.
It's offensive.
It's offensive to me.
Right. Because, I put up a poll.
Right.
And I said, what are you more scared of, regular coronavirus or 5G coronavirus? 60% of the people voted 5G coronavirus.
Yeah, people need to start taking this shit serious, man, because there's people legit dying. I see this shit face to face. I'm face to face with coronavirus. Everybody's sitting at home you know what I'm saying, just pondering and looking at social media. I see this every day. I'm in front of it.
Yeah.
So, you know, for people to say some stuff like that, like, oh, this is the 5G network and all this other stuff, or a lot of people saying it doesn't exist, it's not real, it's just a flu, so what? Nah, man, this is some serious shit.
Right, because at my house, my Wi-Fi has 5G.
Right.
And I've had that for
there's
years.
countries like Iran and Japan, you know, don't have the 5G running. They got the virus.
Right. And there's always
man.
some article, some meme someone sends me that some guy set the cell phone tower on fire, 5G, because he knew the truth. And
to be honest, man, I'm expecting a lot more conspiracy theories popping up than just that.
Okay.
People ain't got a lot of time on their hands and they come up with any story they want.
There's the theory that COVID-19 is a biological weapon, that it was created in a lab. I've heard stories, theories that this was a retaliation to the trade war with China. If you look, the Chinese stock market has mostly recovered, whereas the rest of the world is messed up right now. Was it made in a lab? Was it somehow created?
Yeah, so again, Vlad, these are things that I can't speak on because people are going to come up with explanations that they're just creating, you know, in their brain. I can only tell you what I see in the flesh, in person, when I'm working at the hospital. So the first question I had to myself was, is this real? I had to verify it with my own eyes. When I saw the patients and how sick they were, I'm like, no, this ain't no goddamn flu. This is something real serious because these patients right here, they ain't supposed to be this sick. And when I seen that with my eyes, I could validate this shit is real, number one. And the other thing is that, you know what I'm saying? However it got started, you know, whether it came from the bats and it, you know, the market, the meat market over there, or somebody created in a lab, I can't really speak on that. But it's real, it is spreading, and it's dangerous.
Okay, and the whole thing about it starting in a meat market in Wuhan, China, where somehow it transferred from wild animals to domestic animals. I legitimately heard that from real news sources.
Yeah, and there's like documentaries where they show that as well.
Yeah. Do you know anything about that, or is that just outside the scope of your knowledge?
Not really, but I mean, it could be valid because, you know, you can have transmission. If a transmission of the virus from an animal to a human, and now it's only human to human that is being, you know, that's being transferred from one person to another. So
right, because I've heard that dogs can get coronavirus.
I haven't seen anything or heard anything about that.
A lot of people, like for example, like Meek Mill and Styles P, and I can kind of relate to this myself as well. They were saying how about a month ago they were really sick. They had really bad flu-type conditions and so forth. Heard stuff like that too. They didn't know what it was, and they feel that they may have had it already. And I was, you know, my whole family was sick around December, January, and so forth. So I'm kind of thinking that in the back of my mind as well.
Right.
Could that have been coronavirus, or was COVID-19 not spread to this part of the world at that point?
I mean, I guess there's really no way to verify that, but you know, but the way that people are having the symptoms right now, because those people that got really sick, did they have those shortness of breath symptoms that the people are having now? Because that's a new symptom that you don't see that in influenza, because you have the upper, people have it for like 3 to 4 days where it seems like they have the flu. A lot of people feel like they have the flu, then it gets better. And that's the scary part, right? And you think you're done. You're all done with the infection. And then a day later or 2 days later, all of a sudden you lose your lungs. You can't breathe. And that's when you know it's serious, because now the virus has gone down to you.
Yeah, I know a few people who have it. People who haven't physically seen in a while, like Scarface.
Yeah,
he has it. He said he went through kidney failure. Have you heard of that?
No, I saw a post that he did, and he was talking about how he went through a lot of hell with that virus.
He went through a lot of really serious vomiting and so forth.
It's particularly dangerous, you know, for people that have a lot of comorbid conditions. So people that have, you know, kidney issues, or people that have COPD, lung dysfunction already. It's very difficult for those people, if they seem to be going through it a lot worse than people that don't.
Right. I know an actor named Dennis White who was in the hospital. There is this promoter I know named Sincere who was in the hospital. And I remember Faizon Love. Scarface mentioned that he had it. I know Faizon. I interviewed him not too long ago, and I hit him up and I said, "Oh, you have it." I'm like, "When did you get tested?" He goes, "I didn't take a test, but I know I have it." And he goes, I'm not going to a hospital. That's too dangerous, you know. But I guess he was FaceTiming his doctor, and his doctor felt like he had it, but he's never taken a test about it, so I'm not quite sure how accurate that is.
Right.
I mean, can you look at someone and say they have coronavirus or they don't, or?
Not always, but there's a certain type of symptom that I'm seeing, especially when they pass the flu stage and when they start having shortness of breath. If they don't have any history of any lung conditions, they have a fever and they can't breathe, that's something very unique to this virus. So I get a sense, like certain patients, I'm like, I always think to myself, oh, this one's gonna come back positive. This one, probably not, but I get a sense of it.
Out of all the people that you've tested yourself, what percentage came back positive?
Probably 20%.
20%. So 80% came back negative.
Right.
Okay. There was also, they're saying the doctors from Cuba kind of have a leg up on this type of thing.
Mm-hmm.
I guess a bunch of Cuban doctors went to like Italy and so forth. Do you know anything about that?
Not really.
No, not at all. Gotcha. Explain what flattening the curve means.
So it's a bell curve that they've created to kind of show the distribution and kind of rise and fall of this virus. So they kind of base it off the fact that every one person that has it will probably infect 3 to 5 other people. And based on the length of symptoms that the virus carries of the 2 weeks to 5 to 12 days or whatever of the asymptomatic phase, and then you have the flu-like phase, and then you got the viral pneumonia phase. So putting all that 3 to 4 week window of you having the infection with you infecting 3 to 5 people, they come up with this little graph of it rising to a certain point. And right now, they're estimating that the peak point for the USA is going to be sometime middle of this month.
Yeah, in 2 weeks. And I guess this is sort of the part that a lot of people struggle with. There are some sources that I've read that say that eventually half the U.S. population will get it.
I mean, it's hard to say.
Okay. And when you look at the whole flattening of the curve diagram,
Mm-hmm.
it almost implies that the same number of people will eventually get it. You're just trying not to overload the hospitals at the peak. Is that accurate?
Yeah, kind of. And the main thing we try to tell people is, we don't want people coming to the hospital unless they're really sick. Because again, we was talking about this earlier. You end up contaminating people more by being in the hospital, even if you might not have it and you get it in the hospital. So that's why I always tell patients, don't, or people that ask me questions, I always tell them, like, unless you're really sick. I'm talking like your breathing is truly compromised, or you have the comorbid conditions, you got a lot of medical conditions, your age. If you don't have those risk factors and you just got flu-like symptoms, fever, cough, just relax and just see how it does.
Okay. Well, if someone that you've come in contact with tests positive for it, does that give you the green light to get tested yourself? Or
yeah. So even in the hospital right now, there was actually a patient of mine that tested positive after being in the hospital. So the patient didn't have it, but they later tested positive for it. So now they want me to get tested.
Okay,
because I had exposure to that patient before.
Have you been tested at all?
Not yet.
Not yet. Okay. Are you scared to take the
Vlad's
test?
scared right now.
Hey man, I'm here.
Okay.
That shows my level of bravery.
No,
I'm here
you
right
got,
now.
You got to have that, man.
Yeah, in person. This is not a
you gotta have
FaceTime
that.
interview. We're actually sitting here face to face.
No, I mean even with me, like when I first, we were talking about this, I thought we were gonna do it. Like you see everybody, all the mediums are doing little FaceTime interviews and stuff. Vlad's like, can you get to LA? And I'm like, right now everybody's advising me not to travel. Everyone's trying to stay put in their homes, but I'm like, you know what? Let's do it.
Yeah, well, I watch 60 Minutes. I kind of really base a lot of this company on what 60 Minutes do. And on 60 Minutes, they're interviewing doctors face to face.
Right.
I feel like we have to be on the front lines because we have literally millions of people every single day.
The way I look at it, man, if I could be face to face with COVID-19 patients every day, I could be face to face with Vlad.
Yeah, exactly. So originally, Trump said that by Easter, all the businesses should be opening back up.
And what's
now that got updated to April 30th.
Right.
I personally don't believe April 30th.
I mean, it's hard to say. These estimates that people are making about flattening the curve, these are all estimates, man. This is approximations. We can't really tell until the real numbers come and we see where the direction of this virus is going. If it truly is starting to fade away. Even in China, they're saying now they back to normal, but are they back to normal? We don't know.
Right, and there's that. So there was a report that came out just today that basically said that China had been underreporting the number of cases massively. Do you believe that?
I mean, I can't say it's a fact, but I would it seems pretty odd for me that all of a sudden you had all these people that had the virus and all these people that were infected, that you would have such a dramatic decrease in it.
Right. But the thing that also is kind of strange to me, because look, at the end of the day, China has no freedom of speech. It's a communist country. You can't speak out against the government. You can't have a media outlet that speaks negatively about the government. But you have a bunch of US businesses like Apple, Nike, Starbucks. They have all reopened their stores in China. These companies are all run by American CEOs. And those stores are all closed in the US and Europe. So why do you think that they would open back up in China based on what the Chinese government is saying?
I mean, I think they're just trying to get their rep back up, because I think their economy and just the overall, image of China is completely changed in people's minds. Like, people are scared to do any business with China. So they have to put on some kind of a image right now to say that, hey, look, things are getting better for us.
Okay.
That's my personal opinion about it anyway. You know what I'm saying?
If you were to guess, just throw out a wild number, when will it be when the US and the rest of the world will get back to normal? Like it never happened.
Like it never happened?
Like it never happened.
I don't think, let's say this thing dies down as the curve explains and peaks up.
Yeah.
They're saying it'll peak up in the middle of April, and then it'll level off, and then the cases will die down until June and early July. If that's how the curve does fall into play, I think after that, I think the whole world really is going to still be going through post-traumatic stress for a long period of time. Again, because now there's already talks about the virus coming back.
In the fall.
Yeah, exactly, and having a second wave. So people are going to be basically having their guard up constantly. Because now, look, has this ever happened in history where everything got shut down in the world?
No. I mean, the one thing that I've seen this compared to is the Spanish flu of 1918.
That's a long time ago.
Over 100 years ago. There's literally no living people that have gone through it that remember it.
So I feel like the post-traumatic stress that people are going to have of what just happened, it's not something that's going to go away. People are going to remember that. I think the practices that people are, it's kind of bad in the sense that people are just scared. There's a certain fear that's developed. I walk around and people that would normally be happily greeting me, they were trying to run away from me. Nobody want, like, the social contact is becoming something people are scared of.
Well, explain the concept of herd immunity.
Herd immunity, that's basically when you have, a large population that's faced some kind of infection, and there's like all antibodies that are built up, it kind of, I mean, it's kind of like up in the air as how, truthful or factual that is. But I mean, it could be a true thing.
Well, what it basically means, from what I understand, is that when enough people get it and survive it, they essentially become immune. And the people that don't survive it, they die off.
Right.
And enough of the population becomes immune to the point where it stops being an issue.
Right. Well, I mean, to be honest, viruses are living things too, so they got a mind of their own. They know, if this not working for them, is they mutate. They try to change up, just like humans. So there's constant evolution that's taking place, and then that's why the influenza changes every year. It's not the same strain.
Right, because there's different strains of COVID-19, from what I understand.
There's a couple that they have. I don't really know if they have any more than that right now, but there's the S and the L strain that I've heard about. L being a little bit more aggressive than the S is, but there's still debate as to whether that's real or not.
Okay. Now, originally it was an epidemic.
Right.
Then it became a pandemic, which means worldwide.
Right.
Epidemic means local.
Right.
Pandemic means worldwide. Now, there is the theory that it will eventually become an endemic, which means that's something that's permanently part of human civilization. For example, like HIV and AIDS is an endemic.
Okay.
It's been around for decades. Yes, you can control it. You can take pills for it, but there's new cases every single day all over the world. Will COVID-19 potentially become an endemic?
Yeah, so only time can tell, man. Only time can tell. Right now, we can postulate, theorize about it, but to actually see where it goes from here, it's just, I'm as in the dark about that as anybody else.
I mean, being on the front lines the way you are, how is it affecting you, mentally?
I mean, tremendously, man. I feel like I have to basically contemplate life and death every single day. I walk into the hospital. The second I walk in, I step foot to the hospital. You constantly have this tension that like you're basically in the midst of the max exposure. Everybody's running away from this thing, and I have to run towards it.
Yeah.
So it's just kind of, it puts me in this place mentally where I'm constantly trying to look out for my own self and my family. Because when I go back home and I take the scrubs and the white coat off,
Yeah.
am I infecting my family?
Yeah. And, our main office is in New York. I remember I used to live right by the Javits Center in New York, which is a massive, it's like almost 1 million square feet. And they've literally turned that into a massive hospital with hospital cubicles. And they're even setting up tents in Central Park.
Okay.
So I don't think they're being filled yet, but they're basically preparing for the very worst. Do you think that in the US there's going to be a situation like in Italy where there's so many people that are on the verge of dying that there's just not enough respirators? There's not enough.
It's already happening.
It's already happening.
And even in our hospital, like we're worried about because we don't have enough supplies. We still don't have enough masks. To this day, we don't have enough N95 masks in the hospital. I'm still having to reuse the same mask over to see my patients. So I'm putting myself at risk.
Wow.
To this day.
Well, listen, man, we really appreciate what you're doing and you putting your life at risk to help these people, man. This is like nothing we've ever seen and nothing like we've ever experienced. Like we didn't realize how good we had it in 2019.
Right.
2020 has just been
2020 came and like before you knew it, man, this coronavirus hit and now it's like
well, first Kobe died first, which nobody talks about anymore. Ironically enough, like when was the last time you heard an R.I.P.
Coronavirus
Kobe?
took the press.
It took over, and then.
But Vlad, could you have imagined the whole world shutting down the way it is right now? No. Every person, no matter who they are, getting stuck in their own homes. I mean, imagine, all the people that are getting laid off from their jobs, they're not able to make their money, they're not able to do all those things. And it's just like mentally, I wonder where that puts everyone else in the world. For me, I'm fighting, I'm at war. I'm on the battlefield right now. But I can't imagine what other people are going through that, they just pretty much their life is on pause right now.
Yeah, it's crazy. It's crazy right now. And, before I let you go, you're also a rapper.
That's right. That's right, man. So basically, like the way I juggle, man, I do medicine for 7 days, and then my other career is hip hop. Mm-hmm. So I just got off the tour with the Wu-Tang Clan.
Dope.
So we did the 25th anniversary tour, went like Australia, New Zealand, Europe. All over the U.S. and it's just been an amazing experience. Ghostface Killer, a mentor of mine. I got a record with Ghostface called Decapitation Chamber. Make sure y'all go check that out. You know what I'm saying? I'm from Detroit, man. So I came up in Detroit, with the whole Detroit hip hop culture, D12, those are my mentors in the city, you know what I'm saying? So I came up in that grind. So I was doing hip hop before I was doing medicine. So it's not like, the doctor picked up the the mic, it's always been my passion. One thing I always try to tell people though is that, when people try to live their life and they try to figure out who they want to be, one thing I'm trying to show is that you can do all the things you want to do in your life. Like I'm gonna be a rapper. I'm gonna get on the mic and do what I gotta do, put out records, but at the same time, I can still be a physician at the same time. And people hit me up for their own, whatever their journey is or whatever they want to accomplish in their life, to be able to say that, it has inspired somebody to want to do multiple things in their life. You shouldn't have no limits on you. You shouldn't have any barriers. You should be able to do whatever it is you want to do.
Right. And you actually have a freestyle prepared.
Oh, yeah. We could talk about coronavirus. So check this out. Another obstacle, another hectic day at the hospital. Is finding a treatment possible, or is COVID-19 unstoppable? Sitting here contemplating. How are we gonna be safe when people out there congregating, not listening? Conspiracy theory talk debating. It's just another cold or flu, that's what the rest say. This pandemic got a 4.2% death rate. You spread the virus without knowing it for 5 to 10 to 12 days. That's when you get the fever, cough, and then your chest aches. Viral pneumonia hits is when you cannot breathe. Life-threatening for sick patients and elderly. Ventilators get used up, there's lack of supply. If we keep spreading the virus, your mom and dad could die. We got no vaccine, but medication is getting near. I'm treating my patients with lopinavir and ritonavir. Plaquenil for immune response that gets severe. Clinical trials show success with favipiravir or Ativan being used in China and Japan. So what's the battle plan before stress anxiety gets you to Ativan? Everybody stay inside. The whole mission is to stop the spread of the virus through social distancing. So wash your hands, cover your face, protect your family. Let this time be a reminder we are humble in our humanity. Say your prayers, control your fears, and keep your sanity. I'm about to go in now. Coronavirus wants to battle me. Last
Love
Army.
it. Love it. Dr. Khan, man, I appreciate you coming in, and we truly appreciate the work that you're doing.
Man,
on the
I
front
really
lines.
want to do something for the hip hop community too with the coronavirus, man. Something like, bringing all the hip hop artists together. You know how kind of like Live Aid was with Queen, when they was doing that, like just getting people to come together. Like this week, I've been getting hit up by Black Thought and, Method Man and Fat Joe, just, talking about how this is affecting everybody's lives, man. So just being on the front line of this and an MC at the same time, I'm trying to do something for the hip hop community.
Absolutely, man. I appreciate you sharing your thoughts on VladTV. Man, look, as bad as this is right now, we're going to get through it. I'm positive of it. It's not a question. We're all going to get through it. And it seems like it's going to humble everyone and make everyone nicer. If you're beefing right now, man, you're just a miserable fucking person, man. like this is really the time to really let all that go and really help each other out. And that's how we're going to get through it together. All that pettiness and bitterness and beef and whatever else, man, let's all work together and get through this bad chapter in our lives and tell our grandkids how good they have it right now and how we actually fought this thing and won.
Right. And like I said, the coronavirus, man, ain't coming in to be no guest in this world. You know what I'm saying? It's coming in to take it. You know what I'm saying? And we have to stop it.
No doubt. Dr. Khan, appreciate you coming in.
Thank you.
Peace.